What's up, guys? It's Dr. Jim. I am your CBD expert. Welcome to tonight's live. Once again, when you get on, welcome everybody. Glad to have you. What I'd like you to do is go ahead and put your name and whether you're watching this live or on the replay. I love to know if I'm getting you live or on the replay. Thank you, Nicole, for joining me tonight. I'm sure there's going to be a bunch of people jumping on. I won't be able to give a shout out to everybody, but thanks for climbing on tonight, everybody. It's going to be a good topic. It's something that I hear a lot of from a lot of people, and I think you're going to be excited. And it really has to do with CBD oil and kind of how much should I be taking? What's the right dose? Because I hear people all the time, I recommend, hey, here's CBD oil. I really recommend it for the conditions that you have. I really think it would be really, really helpful for you. And then sometimes they come back and they go, oh, I did this or did that, and I don't think is it working for me? Is it not working for me? So I want to clear the air tonight, clear up any confusion you might have about how much CBD oil should you be taking, how to dose it, and really what's the best way to do that. So once again, I'm Dr. Jim. I am your natural healthcare expert. I am a chiropractor for many years here and for 20 years here in Richmond, Virginia. Thanks, Tim, for getting on. Good to see you, man. But these are, I've been a chiropractor here in Richmond, Virginia for 20 years. I am a natural healthcare expert, and you are now in the worldwide headquarters of CBD information, and I just want to welcome you on. So we're going to talk about CBD oil and how to dose it and how do you know you're taking the right amount. Well, what's really interesting about CBD oil and whether you're taking the right amount or not, or how much should you be taking, the answer is it depends. And I know that's exactly what you were looking for tonight, was something that firm and hardcore of an answer, but the truth is it depends. We don't know exactly how much you should be taking, because how much you should be taking is individual for every single person. And there's a number of reasons for that. Certain conditions require certain amounts, but not even just looking at it from a condition standpoint, but different people have what we call biochemical individuality. So every person is different, therefore they're going to require different amounts of CBD oil to have the impact that they want to have in their bodies. So what does that mean, biochemical individuality and how that affects different people? Well, think about it like this. Different medications have different impacts on different people. Some people can take one medication, they can't take another. Well, CBD oil can work very similar in that everybody has what we call their sweet spot, or the right amount, and that will be different for everyone. And there's a lot of factors that go into it. So take this for example. Let's say you eat a really, really clean diet. You're gluten-free. And see, being gluten-free actually clears up a whole bunch of receptor sites in your brain, so you may have a bigger impact from a smaller amount of CBD oil. So how you're supposed to dose CBD oil will be different than it might be from somebody who's just eating gluten and sugar and everything else every day, and their receptors are all junked up. They may need more CBD oil. So when we talk about dosing CBD oil, it's very, very important to realize that it's completely different for every single person. It's also very important to mention that it may really depend on what CBD oil you're taking. They can all be very different. They all come in different foundations. There's different ways to take them. So I can only really talk to you about what I recommend. And I recommend a very specific brand that I know to be very pure, and I know the impact that the amount that I take or that I recommend for people, I know what works really, really well for people. So if you take CBD oil already, go ahead and give us some thumbs up or some likes. I want to know that you're out there. Once again, get your name in there, where you're watching from, and whether you're seeing it live or on the replay. So a number of things when it comes to dosing that will impact how much you should be taking from a CBD oil standpoint. Well, there's a very simple rule of thumb. Low and slow. that's really how you want to start taking CBD oil. Now, I don't know how professional it makes me, but it just makes me think of a Beastie Boys song that I used to listen to, Slow and Low. That is the tempo, all right? So that's exactly how you want to take your CBD oil. What is recommended for the oil that I recommend, and if you want to know what that is, you can always message me at the end of the video or message whoever sent this video to you, and they'd be glad to tell you the CBD oil that we recommend. It's high purity. Yeah, it's a great song, right, Steven? One of my faves. I didn't know if I should play it for the video or not, but if you overdub it in later, it'll sound good. But what we do know is that each person responds and acts differently, and so what you do is you start low and slow. So with the CBD oil that I recommend, you would start 3 to 5 drops, okay? And we take ours sublingually, underneath your tongue. Now, a lot of people go, well, how do I know what 3 or 5 drops is? Well, number one, if you take it in front of the mirror in your bathroom, you watch them and you count them as they drop in underneath your tongue. And you're like, well, that's great, except I'm on the move. Well, I would recommend getting a little compact mirror and then hold that up and you can look at it as you drop it in. That's a really, really good way to take it, okay? If you do, count them off, 1, 2, 3, 4, 5, good. So you would take 3 to 5 drops to start. Now, you do that morning and night. Now, what you're looking for, well, number one, you're looking for any reaction that doesn't feel great, okay? Because one of the things that CBD oil can do is it can really sort of accelerate this detox effect, and a lot of people are really, really toxic. And so if you start taking it and you get a headache or you don't feel well, maybe it aggravates a symptom that you were trying to get rid of, like if your arthritis feels more tight, or if you feel a little more anxious, or you can't sleep, or you feel more anxious than normal, those would be indications that you've overdone it, that you've taken too much to start and you want to back down. Those are called the Herxheimer reaction. It's a very common thing, but you're looking for, if you take it, do you have that kind of reaction? And if you do, it doesn't mean that it's bad. It doesn't mean that it's not working for you. It just means, actually, it means you probably need it more than everybody else, because it means you're really toxic and your body really needs to find balance, and all you do is you back it down. My sister-in-law, who's probably watching right now, started with 3 and it did not do well with her. She backed it all the way down to 1 drop and then slept like a baby. Slept so well that she had her first dreams that she can remember since grade school. So my point is it's you start low and slow. So start with that 3 to 5 drops. If you're concerned, start at 3. You do that for a couple days, and if you're not having any negative impact, you don't feel a headache or any of those increase in symptoms, go ahead and move it up to 5. And you'll do that morning and night. And then as you keep going, you can keep going up. Different conditions, a serving of the kind that we use is usually considered like 10 drops in the morning, 10 at night. That's a total of 20 drops, which out of the 500 milligram bottle is a total of 10 milligrams. All right. So every drop has a 0.5 milligram of CBD in it. So that's a good way to look at your dosing. A lot of the research out there says that dosing and sort of ideal dosing can be, like 12 to 24 milligrams a day. And there is dosing anywhere from 2 milligrams to 200 milligrams. Now, the 200 milligrams, I don't even want to talk about that. That's being done in studies. And that, not all of that's natural CBD oil. Some of it's synthetic. So we won't even talk about that. But what you're doing is you're starting off on that 3 to 5 drops. Everything's good. Maybe you notice some positive relief. You're like, man, I slept through the night for the first time in years. That was amazing. Okay. But you're like, but I also got really painful and achy joints. Well, sometimes, chronic pain is going to require a higher dosage. So what you do is you get through that. Okay, I noticed this positive, but I still have this other thing that I want to get better. So then you up the dose a little bit. Wait 3 or 4 days, up it again. Okay. This is the great thing. You're not going to overdose on CBD oil. If you drank that entire 500 milligram bottle at one time, which I do not recommend, please don't do that. But if you were to do that, you're not going to overdose. So if you go 3 to 5 drops, then 5 to 7, and then 7 to 10, and you're doing 10 in the morning, 10 at night, and you're like, well, that's real. I feel great, but there's still some improvement I'd like to see. Then what you do is go ahead and keep upping it until you get the results that you're hoping for. Now, when do you stop upping it? Well, you stop upping it if you bounce up against a roof where you go, oh, now all these good things I was feeling, I'm starting to not feel great again. So some people go 5 drops in the morning, 5 at night, and they're like, man, I'm sleeping great, my anxiety's reduced, I feel really great. And then they go to 10 drops and they're like, my sleep is stinking again, my anxiety's up. Guess what? Back it back down and hang out there for a little while. Let your body adapt and adjust. And if there's still additional issues out there, then you can up it. Mario, yes, this is great for diabetics. Great question. Basically, CBD oil has been shown to help reduce blood sugar levels, so it's great for diabetics. But so when people ask me about very specific conditions and how much they should be taking it for, what I usually tell people is it will all depend on you. So you start with that 3 to 5, and then you just slowly increase it until you either hit a ceiling where you don't feel well anymore, or you keep going until that condition starts to balance out. And that is really how you dose CBD oil. Now, so once again, the question is, how much should I be taking for my specific conditions? And once again, the answer is, it is all dependent on you. It really depends on your body, how your body reacts to it. So is it good? I'm getting some great questions, so I'm going to try to be as interactive tonight as possible. Is it good for type 1 and type 2 diabetes as well? Absolutely. With type 1 diabetes, once you're a type 1 diabetic and you no longer make insulin, what you're going to be doing is you're really affecting more on the insulin receptor sites the same way you are in a type 2 diabetic. So at that point, you're really affecting the level of blood sugar at the same level, and you're reducing certain things like cortisol levels and those kind of things, which have a tendency to raise blood sugar. So yeah, they work great with both. Thank you for the questions. Good questions, everybody. I haven't been answering a lot of questions during these. So how do we dose for specific conditions? Slow and low, that is the tempo. 3 to 5 drops to start. If that seems like too much, back it down to 1, then go to 2, then go to 3, and you stop when you hit your ceiling, and that's how you do it. So with the brand that I recommend, that's a good question. With the brand that I recommend, there's a couple things. So we talked about the 500 milligrams. People often ask me, should I get the 500 milligrams or the 750? Well, this is the thing. I always recommend that you start off with the 500 milligram bottle. What's the difference between the 500 and the 750? Well, this is the thing. There is no real difference. It's just how much CBD is in that bottle. The bottles are the same size. One of them has 500 milligrams of CBD in it. The other one has 750 milligrams of CBD in it. So what happens is, it just means that the amount of CBD per drop goes from 0.5 milligram per drop to 0.75 milligrams per drop. So you can actually do the same dose. If you're doing 5 of the 500, you may only have to do 3 of the 750. It just means that the bottle lasts longer, okay? But it does make it it does make it more difficult. What if you only needed to take 1 drop of the 500 and now you've got the 750 and it feels like it's too much? So that's why I always recommend people start with the 500. And if you find that you're doing 25 drops in the morning and 25 drops at night, well, guess what? I would get the 750 the next time you order. And that's a great way. So get with the people that recommended this video or myself and order what you need. And that's probably the best way to do it. So that's really how you dose it. A couple things. I've been given a couple things. Number one, do we like me doing these here in my office, or did you like it better at home? I got some advice from a friend who was like, hey, you should probably do those in your office. It looks more professional. So I thought I would try it here. Let me know if you like it better in my office or at home. I like comments always. And the other thing is we were going to try to keep it shortened down, so that it doesn't get so long and then we lose a lot of people. Yes, Mario, I do personally take it. I take it, I give it to my wife takes it, and my 10-year-old son. All because, an important thing, and this brings me to a great topic part of tonight, because people want to really dose specific conditions. And I really want to recommend people to not think about CBD oil like a drug or like a medicine, okay? Because really, if you think about it that way, you're literally just trading one drug for another drug. Now, granted, CBD oil is an incredibly natural substance, but don't treat it or use it like a drug. Think of it more like a supplement. What just happened there? I lost some. There we go. Think of it more like a supplement, where it's something you want to take to maximize your health. So what you do is you just want to maximize your health. You're not just trying to treat a condition. So people go, well, for my nerve pain, how much should I take? For my anxiety, how much should I take? And what I tell everybody, just like I tell everybody on every video, I'm not here to diagnose or treat any exact condition. I'm not your doctor. You're not my patient tonight. So I don't make any specific recommendations like that. But what I can tell you is this. How much CBD oil should you be taking? It is different for every single person because of your biochemical individuality. Go slow and low and work up. If you start to have any kind of reaction that doesn't feel great, that is most likely a detox reaction, which doesn't mean that you shouldn't be taking CBD oil. It probably means you probably need to take it just as much, if not more than everybody else, because it just means you're really toxic. And so that's a really, really important thing. So everybody, regardless of condition, may be taking a slightly different amount because it depends on what's going to work best for their body. All right? So that was really the live tonight. That's what I wanted to talk to you about. I hope you got a lot of value out of tonight. If you got value, please give me a thumbs up and comments. I love to go back and read your comments. If you have any specific questions for me that aren't ridiculous, I saw some ridiculous questions. But if you have any questions for me, thank you for the hearts and the love out there. I appreciate it. Go ahead and you can just you can leave a comment or you can direct message me. I'd be glad to help everybody. I am your CBD doctor. I'm Dr. Jim, and I just want you to know, I want you to be your very, very best today. #never quit. And if nobody's ever told you this, I want you to know this. I believe God wants the very, very best for you, and the day that you believe that, it will change your life forever. All right? You guys have a great night.